Next stop, small intestine. Small because diameter, how round it is, but it's not small as far as length. In fact, it's the longest section of your entire GI tract, stretching about 18 to 20 feet, depending on who you are, whether you're a child or an adult. But the small intestine is really important because within the first 6 to 8 inches of it is where most of that digestion in your entire GI tract will happen. You digest a little bit of sugars in your mouth, no digestion in the esophagus, a little bit of protein digestion in the stomach, but now the bulk of the digestion is going to happen in the first segment called the duodenum. So the duodenum is connected to your pancreas and your liver, and it's going to take lots and lots of enzymes from both to break down proteins, carbohydrates, and fats. When you look at the 4 layers, it's really important to remember the 4. The first one, of course, is the mucosa that releases mucus, but also releases the enzymes to help break down those 3 nutrients. Next is the submucosa. The submucosa is especially important in the small intestine because it's full of blood vessels that absorb those nutrients. If it weren't for the small intestine absorbing all those nutrients, they just pass straight through you. The third layer is the muscularis. This one, we're going back to 2 layers. You have the circular layer and the longitudinal layer so that you can squeeze, and not so much for smashing the food to digest like we saw in the stomach, but more squeezing the food. And I like to think of like this. It's like Play-Doh. When I squeeze the food, I squeeze my Play-Doh, and the Play-Doh squeezes between my fingers where the food Play-Doh can make contact with my skin, right? When your small intestine squeezes it, you'll actually see there are lots of little things called villi that are like finger-like projections that have the food pass through and get absorbed into your bloodstream because of that. So just like squeezing Play-Doh, having all these villi let more contact area happen. Right. We'll look at the different layers, and then of course the last one after the muscularis is the serosa, the outer layer. So it is slide number 12, small intestine. I actually pulled mine out already. You're going to put your stage all the way down, flip to the red objective, the first objective, center into the light. Let's take a peek at how we did. Nice. You see a little bit of pink. Bring it up, of course. There we go. Ooh. And, oh, there's the edge of it. See what we can see. Very cool. Wow, it's not a very long section, but what's nice is if I put it right here, and you can do the same, I can see all 4 layers. So the small intestine, remember, is only small because of its diameter. So even the thickness of the wall, lots thinner than when we saw in the stomach. But if we start at the top, way up here, boop, this light area at the top, that's your lumen again. So the lumen is where the food is sitting. And remember, the food has to be the consistency of baby food. You're not going to get a lot of mechanical digestion in the small intestine. You're going to get mostly chemical digestion. So the lumen here is just flooded with this gooey baby food, right? This is kind of cool. It looks like a weird pattern. You have to remember the finger-like projections like this are right here. So here's a finger, here's a finger, here's a finger, here's a finger. We're looking at it like this, but when the microscope slide got sliced, it may have sliced off at an angle with this group over here, and that's why you're only seeing like tips or knuckles of the fingers. Right? So right here, with the fingers, we want the food to come down and around, smother around the fingers, so that the nutrients can be pulled inside the fingers and down here, oops, into that connective tissue where all the blood vessels are at. Right? I don't know if I saw the blood vessels. I quick scanned across. That possibly could be a blood vessel. Let me come back. Okay. So, whoops, possibly a blood vessel right here on the edge. I'm going to go ahead and jump in a little bit closer and see if I can find it and point it out. Nope, no such luck. Let's scan. So up here at the top, These are all your villi. It's your epithelial lining going up and down like a million little pillars. And if we zoomed in closer to one of these at the surface, let's see. Yeah, this will be good. Can you see this dark purple line right here? Those are called microvilli. So this one projection here is a villi. The little black line is a microvilli, and that's the site of absorption. So let's get a little bit closer. I'm going up to 100 times magnification. Okay, so I can see those microvilli a little bit closer along here. I can see their nuclei, the dark purple dots, right in there. Same thing here. I got little hair-like structures at the tip of my microvilli, my nuclei. It's going to be a tricky one, but oh, it is already on 400. All right, well that's about as close as I'm going to get with this. You can always switch to your 20x ocular piece and go in. Just come back. Get my fingers again. Finger right in there. Very cool. So I can see these long cells and these dark nuclei down here along the bottom. So I actually have column-like cells going along here called microvilli. If I come back out, let's look at the next layer. Remember, you should draw a picture of this. Here are 4 layers. I'm back on the scanning objective. Let me focus it a little bit better. There we are. So I started by talking about the epithelium, right? Up here. These are your villi with microvilli on the tip. Down here's that connective submucosa, which ideally we would find some blood vessels in. Next, we have 2 layers of muscle. There we are. And you see it here. 1 layer. So a circular layer that wraps around the small intestine, and the longitudinal layer right here of muscle. And then of course our serosa or adventitia is back here. So same 4 layers. We found it in the esophagus, we found them in the stomach, and now we're finding them in the small intestine. Okay. Our next stop, large intestine.